nursing students are the future of healthcare here in Manitoba, but many students right now are saying they're facing challenges as they work toward their degree and RN certification. There's concerns over a number of things: parking, long unpaid hours, even safety. Luigi Imbrogno is a student nurse at Red River College Polytechnique. He's in his final year of nursing school. He's also a board member of the Canadian Nursing Students Association. Last week, he put out an open letter highlighting how some of the hardships that nursing students are facing right now. And Luigi's in studio. Good morning.
Good morning.
So can you elaborate on the concerns that I raised that are part of your letter, and parking, for example, long unpaid hours? What's it like?
Yeah, I've chatted with over hundreds of students since I got back from Edmonton. We had our national conference where we had great speakers tell us that we are the future and we need to, demand safe conditions and things like that. So I took that to heart and came back to Manitoba and, discussed with my colleagues at all institutions, whether they're LPNs, RPNs, RNs, and everybody was saying the same thing. There's a kind of financial insecurity that comes along with nursing school. From the start of the program, we're told working outside the program is not recommended because of the demands of the program, and then also having to be in the hospital 1 to 3 days a week for that clinical aspect where we're putting into practice what we're learning in the classroom. So working outside the program is discouraged and not easy to do. And then on top of that, paying tuition to be in the hospital for 12 hours, giving that unpaid labor, paying up to $24 to park nearest the hospital, or that safety piece comes in where students are parking 3-4 blocks away where they can save $1. And I've heard students are getting chased to their cars or catcalled and harassed just by people on the street.
In what areas of Winnipeg have you been hearing that about?
Around HSC and St. Boniface mainly.
Okay. Yeah.
So I've heard that a lot where, that's where the parking is the biggest. And especially around St. Boniface with construction going on, they've reduced a lot of their parking near the hospital. So students are parking at the Norwood Hotel or, areas like that.
There's a poignant piece of your letter where you write, quote, "If the health authority deems us competent enough after 450 hours of clinical training to contribute to the staffing crisis, it raises the pertinent question of why the rest of us are expected to do so without compensation."
Well, exactly. You could have a classmate that is in the exact same spot in the program of you with the exact same training and education, but they were lucky enough to get one of the undergraduate nursing employee positions. So they would be doing the same thing as you in clinical, except they get, paid for it. They're supervised. Everything is the same as if you were in the hospital for clinical, and you're still being supervised. And that 450 hours is what the government deemed acceptable for, skills and competencies to work in a acute medicine, surgical, or mental health unit.
What do you hope is heard from what you're raising in this letter? Obviously, a big focus right now of the NDP, provincial government, is retention of nurses. So I'm wondering whether or not part of this is saying you're going to lose us if you don't fix these things. Can you kind of tell us what you're hoping the response might be?
Absolutely. Just an easing of that financial insecurity we're all feeling. So with this, after our theory is completed in the program, nurses have to do 450 hours of consolidated senior practicum. So that equates to about 3 months of full-time work. So you're not being paid for that, and most Manitoba student aid will end after that theory period is over. So now you're entering this last portion of your training, the last step to become a nurse. You're in a mountain of debt. After this, you'll need to pay for your NCLEX exam, which is your licensing exam, and then also pay the College of Registered Nurses up to $1,000 to register. So those are upfront costs we have to pay after working 3 months of unpaid work, after 4 years of unpaid school. So there's not a great deal of support for students, and then especially for new grads coming out. And so a lot of the nurses I've talked to said they don't plan to practice in Manitoba when they graduate. They're fine getting their education here, but a lot of them said they plan to go otherwhere. Not that it's going to be great in other places, but it's not great in Manitoba, that's for sure.
It might make someone say, after that, after going through all that and incurring the debt and facing the concerns you're talking about, why would you leave then? What are you hearing from people about that? Because by the time you get to that point, you're at the point where you're going to be paid. Are you just so frustrated by being here? Or
a general frustration with the province, because as we hear in the news all the time, registered nurses that are working aren't being treated, great right now, and there's struggles they're facing. So I think it's just that the grass is greener on the other side type thinking, that we've just been not treated well by the province for years and years and years. And we're hoping that it's going to be better somewhere else, or the students that plan to leave are hoping that somewhere else is going to be better. And a lot of places, Manitoba included, offer signing bonuses and things like that. So I think they're have their sights set on what's going to ease the financial security the most.
So specifically in your letter, you call for immediate things. You say there are immediate steps that students and hospitals can collaborate on. Where does that start?
So parking would be the biggest thing. So that would ease transportation and safety concerns. So if students didn't have to worry about their card getting declined for $24 of parking, then they can park right at the hospital and not have to worry about walking 4 blocks at 5 a.m. or 8 p.m. alone. So that's something that the institutions, our educational institutions, and the government can all work together on.
How are students working around the challenges you've raised so far?
So a lot of them are still working, trying their hardest, and then just showing up to class at 8:30 the next day with no sleep, or they're relying on family members to help drive them to places and provide that financial support. They're doing whatever they can, really.
And when you say with no sleep, what is the change that would allow for better balance for students?
Well, if we got some sort of stipend or some sort of payment throughout the program just to ease some of those financial concerns.
So you'd still be tired, but you wouldn't be having the stress of the debt.
We wouldn't need to be working till 11 p.m. the day before we had a class or a test if we knew that money would be coming from somewhere else.
Got it. You're not going to be picking up other things to be able to pay the bills, the rent, whatever it is.
Exactly, because they're finding the time where they can, which is often in between tests or clinicals or things where they should be using that time for self-care or for studying or for things like that. But instead, they need that money to work.
Will you stay in Manitoba? Like, how are you feeling about the job as you get ready to graduate nursing?
Well, I've talked to students and nurses across the country, and really this is a nationwide problem. It's something that really isn't going to be better anywhere you go. I love my family and my friends, and I plan to stay in Manitoba. But I do really, I'm here for a reason. I'm here to advocate for change because I don't want to enter a work environment that is going to perpetuate this kind of treatment of nurses or student nurses.
And just as a last question, have you taken your concerns directly to Shared Health, and have you had a response?
I have. So I reached out last week on Thursday to Shared Health, as well as the HSC, Grace, St. Boniface, Vic, Concordia, Seven Oaks, and I have not received responses back from the region yet.
Thank you very much for coming in to tell us about this letter and the concerns that you've heard from nursing students. Appreciate it.
Absolutely. Thank you for having me.
That's Luigi Imbrogno, a student nurse at Red River College Polytechnic and a board member with the Canadian Nursing Students Association. So we have reached out to Shared Health for a comment. Our request, though, late yesterday, we have not yet heard back. If you want to weigh in on the listener line, especially if you are a nursing student, we would love to hear your perspective and your concerns. 788-3205.
Thank you for watching the CBC Manitoba YouTube channel. Don't forget to like and subscribe. For the latest breaking news and top stories, download the CBC News app.